Good afternoon, and welcome to the next installment of the Beyond the Blueprint webinar series. My name is Greg Malkery. I'm the Managing Director at the Spyglass Consulting Group. I'm also the host of the Beyond the Blueprint webinar series. My guest speaker today is Dr. John Lee, former Chief Medical Informatics Officer at Allegheny Health and a distinguished expert in healthcare informatics and data governance. John, welcome to our webinar. Could you please introduce yourself and provide us with a few opening remarks?
I am John Lee. I'm an emergency physician, still practicing. I also do a lot of clinical informatics work and have opened my own consulting firm, HCIT Peak Advisors. I'm passionate about using information technology to solve the problems that we have in our healthcare system. And there's a lot of problems to be fixed. And I think we'll touch upon a lot of these in our discussion.
Well, thank you, John. Also joining us today are our sponsors. We have Lars Anderson from Storage Systems and Keith Washington from Simplify Medical. Lars and Keith, could you please introduce yourselves?
Hi, this is Lars Anderson, Director of Sales and Marketing at Storage Systems Unlimited. We're a distributor of a number of items that you'd find in just about every department in a hospital that is storage related. And appreciate John for taking the time out of his day to join us and share some insight into data governance.
Yes, this is Keith Washington. I'm with Simplify Medical. We do cart-based mobile computing, point of care technology work in hospitals and health systems, and really glad to have John here today. Looking forward to the webinar.
Great, thank you, Keith. The Beyond the Blueprint webinar series explores strategies and approaches to using digital tools during a hospital remodel, new construction, or renovation project to enhance the patient experience, boost staff productivity, and lower the cost of care. Today's webinar focus will focus on the critical role of data governance in supporting large-scale healthcare IT projects as healthcare organizations transition to value-based care. So why don't we get started? John, maybe you could start us off by defining what exactly is data governance and why is it so important for healthcare organizations as they transition to value-based reimbursement and patient-centered care models?
Data governance. It's kind of a dry, boring subject, but it's something that needs to be addressed. And if you can, I think the summary of what you're trying to accomplish with data governance is that you want people to understand what something means and in which context, and it's something that is easily reproducible and understandable and accurate across the organization. So in effect, that if you ask a question as an end user, then use analytics to answer that question, that answer needs to be accurate. And it has to mean the same thing to you as everybody else in the organization. And you have to understand where that answer is coming from. Unfortunately, I think a lot, or actually even maybe most healthcare organizations, they approach this in a very ad hoc manner. So you'll have a project, you're wanting to know about diabetics and how poorly they follow up with their A1Cs, or whether you're following up properly on some sort of incidental radiologic finding. The problem is that many of those definitions and analytics are created in an ad hoc fashion. And then once you do that sort of data definition within that structure, then that work is kind of lost. It's siloed. And it's not very reproducible. And what data governance is being able to say that what you looked at with the poorly controlled diabetics 2 years ago is the same as when a new project for poorly controlled diabetics that has come up in the past 6 months. And I think that to a large extent, healthcare organizations have approached it the same way as the sort of famous a Supreme Court case back, I think in the 60s, where they asked the Supreme Court justice, "What is porn?" And he famously responded, "Well, I don't know how to define it, but I know it when I see it." And so imagine having that sort of approach. What is a poorly controlled diabetic? Well, I don't know. I don't know how to define it, but I know what when I see it. What is a septic patient? I don't know. But I know it when I see it. Extrapolate that many different, and you could see that you can end up with pure chaos. And what you need to be able to do is you need to be able to say, poorly controlled diabetic in this situation is the same thing as in this situation. And if you want to have separate definitions, go ahead and have separate definitions, but be clear as to what that means. Poorly controlled diabetic with last A1C greater than 9.5, poorly controlled diabetic who's a diabetic who happens to be repeatedly hospitalized, and make that clear that what those definitions actually are.
Great. Thanks, John. What constitutes the ideal data governance strategy? And could you help us identify the critical components, including people, processes, and tools required to successfully support a large-scale IT deployment?
Well, I think you have to get away from what I just discussed, what I described in terms of having kind of an ad hoc rolling data definition approach. You have to have some an overall plan. You have to have a governance both on the operational and also on the clinical, and also involving IT, because so a clinician may have this image of what is a septic patient, but they don't know that when that the data pieces that can constitute that are scattered in all sorts of different parts of the electronic medical record. The data people would be able to come in and say, well, you defined it this way. This is how we would construct it, and have them come in the middle and understand that the clinician's definition actually translates to whatever the technical or digital the definition actually is. And you have to do that on an ongoing basis, because these are complex issues, and you're not going to get it right, and you may need to do multiple iterations, and you need to have that sort of ongoing iterative process to continue to refine the model.
All right. Hey, John, as healthcare organizations transition to value-based care models, what are some of the key challenges that they're likely to encounter? And how can healthcare organizations effectively address some of these challenges?
So I think I touched on one of them. I think the biggest one is the impulse to address these things in an ad hoc manner without any sort of pre-planning or overall governance structure. And the problem with suggesting that to a lot of organizational leaders is that sort of approach, having that rigorous, governed, disciplined approach, takes a lot of time and effort. And that time and effort doesn't have an immediate return on investment. You have to have that kind of infrastructure and plumbing and in place so that you can actually use that later on. It's one of these things that you put in a lot of effort. It takes a lot of organizational discipline, and you only get the return far downstream. It doesn't have a quarterly, even annual return on investment, but it's something that you have to do if you want to do anything with analytics, and particularly if you want to go into any sort of value-based reimbursement payment model, because you have to have these definitions, and you have to understand that when I say poorly controlled diabetic, it means the same thing to me as it does to the CFO, as it does to the nurse manager.
You mentioned something during one of our conversations about the CPT FFS tools. What was the implications of that, and why does that kind of resemble putting lipstick on a pig? I think that was the term you used.
Yeah, so it's not that data and analytics aren't important in a fee-for-service and CPT-driven world. It's just that they're a lot less important. You can cover up a lot of stuff, hence my comment about lipstick on a pig, by just generating more volume. So if you so the data that's actually the most important in a CPT or fee-for-service driven world is just the volume, dropping the codes, and it becomes a lot more complicated if you go into value-based care. Again, going back to that metaphor of the Supreme Court judge, define porn, define, or well, in the healthcare world, define value. It becomes a lot more nebulous. And I think that's one of the reasons why fee-for-service has stuck around for so long. Many other reasons, but a big reason why it's stuck around so long is that it's so easy to measure. You don't have to have a lot. You've already had decades of essentially data governance surrounding this in the form of CPT codes and ICD-10 codes. You don't need much else other than that.
Well, why are things so much more complex as we go to value-based care that you just mentioned? What's the complexity that we should be aware of?
Because there are many different features. It isn't just I did a colonoscopy, I'm dropping the CPT code. I did a hip replacement, I'm dropping the CPT code, now I'm getting paid. Now you have to aggregate tons of other information from various parts of the data ecosystem and aggregate that, mash them all together, and come up with this concept of quality. And because it is so complex and you can have lots of different variables, it makes it a lot more difficult. And to get to that level of functionality, you have to put a ton of extra effort into this on the front end, and a lot of organizations don't necessarily have the appetite for that.
Got it. John, in implementing a data governance strategy, it often requires cross-functional collaboration and buy-in. How can healthcare organizations foster a culture of data governance and encourage participation from a wide range of stakeholders, which could include clinicians, administrators, and IT professionals?
I think the key is not to try to boil the whole ocean. Start off with small achievable steps. So for instance, instead of creating an entire ecosystem of value-based concepts, maybe start just in the emergency department and focus in on 2 or 3 quality metrics and iterate on those so that people then understand not only what those things mean, but also understand what the process is like and what is ultimately the yield on the other side, that once you put in a lot of effort on the front end, then all of a sudden at some point, they start becoming easier. Instead of somebody reaching out and asking the BI team, hey, our ED volumes and turnaround times have gone up. I need a report on this. If you have the right data definitions in place and you have the right reporting tools in place, the person who previously requested that sort of information can actually get that information on their own. It makes it easier for them. It makes it easier for the analytics and the BI team, and the end users end up getting the answers faster and more accurately.
How would you propose that we increase the savviness or increase the data literacy for members of these different stakeholder groups? Are we going to encourage the ED doc to learn Python so that they can be able to access the data? Because clearly the analytics and BI team only have so much time. How do they become partners in crime?
Well, I think you have to meet people halfway. So a metaphor that I often like to use in this sort of situation is the concept of crude oil and the gasoline in your car. So as a driver, you don't need to know whether the gasoline came from light sweet crude or sour heavy crude. And what you do know is that all the different refining processes that exist allows the output to be the same, 90 octane gasoline. You stick that in your car and you go. If you try to stick crude oil in your car, more than likely your car is going to not function properly. If you try to put diesel in your car, again, your car is not going to function properly. And people know that. And so if you extend that metaphor to the clinical and operational folks and the data and BI people, you don't ask the clinical and operational folks to learn Python or SQL or any of those things. But what you do is you use Python and SQL to come up with really understandable data features that really are intuitive for the end users to use, so that you can say patients who came in for surgery, their average patients who came to the emergency department with certain surgical problems, appendicitis and cholecystitis, end up waiting on average 12 hours for their surgery. That is too long. These are the associated features of when that occurs. That typically occurs when these patients come in at between after 4 p.m. So then that can maybe cascade down and say, hey, we need something called a surgicalist program so that we can jump in and actually take care of these patients sooner than the 12 hours. It may, that's just a hypothetical example. The numbers may be actually different, but what you want to be able to do is, again, distill down the concepts of when the patient actually had surgery, and then do the math for the end users and say, these are the types of patients that had delayed surgery. The concept of delayed surgery is distilled down. That is the gasoline from the raw data of when the patient came to the emergency department, when the patient had surgery, what kind of surgery that they had, who is the surgeon, and it's all of those things that I think that is kind of the raw data crude oil that once you process it through some sort of refining process, out comes the gasoline that the end user can use and stick into their car and have confidence that the car is going to run properly.
Are you seeing examples in your consulting practice where you're starting to see increased synergy between the analytics and the BI team, along with specific stakeholders who may be, maybe it's out of endocrinology, right, where they're trying to focus on diabetics. Are you seeing examples where you're starting to see the stakeholders step up to the plate and want to work hand in hand with the BI group?
Yeah, there's one engagement that I have where we've presented kind of prototypes of things that they can do, and the light bulb starts going off. And ultimately what you want to do is then have the light bulb go off, attach that to a smaller achievable project. Then as they recognize the success of that and they start understanding the power of the analytics, and also understanding that what we can do on the analytics side and the BI side to distill down the concept into something that they can use and interact with, eventually you start getting wins, and those wins then start creating a narrative so that other people in the organization say, hey, they improved their process with this sort of tool. Can you make something similar for us? So then hopefully then what ends up happening is you end up getting organic growth.
Awesome. John, how can healthcare organizations anticipate future trends in data governance and remain responsive to emerging market needs and requirements, especially as these value-based care projects are coming online?
I think that, it's sort of counterintuitive, but what you have to do is you have to actually kind of slow down to be nimble, slow down, be that tortoise in the tortoise versus the hare fable, that don't have the knee-jerk reaction to just and particular problem and ad hoc solution. Slow down. As you understand the question that's being asked, then first thing that you should do is, how does this fit into the data governance structure? Is there something actually from a previous project that we can pull out and repurpose, and then fold in anything new that we need to do into that ecosystem to come up with an answer? And then what ends up happening, hopefully, is that as you create new products and fold that into the governance structure and make the contents of your governance ecosystem easily accessible, available, and understandable, then it ends up, you end up doing less work, because what you end up doing is repurposing a lot of the stuff that you've used before.
Great. Hey, John, thank you very much. A lot of the discussion we're having today kind of aligns closely with the results of Spyglass's latest study, focused on digital patient engagement, that we published earlier this year. The report uncovers market trends driving investments in usage models. It identifies opportunities and challenges for supporting large-scale deployments, and suggests how healthcare organizations can leverage these tools to prepare for future healthcare delivery models. Learn more about my report. You can visit my website at www.spyglass-consulting.com. Well, thanks for joining our webinar today, where we discuss the critical role of data governance in supporting large-scale healthcare IT projects, especially as healthcare organizations are transitioning to value-based care. Before we wrap up, though, we have a couple of polling questions for the audience. Keith, I wonder if you could please display those questions now. I would ask that audience members viewing this video will provide their comments in the section below. The two questions are, rate your organization's patient safety culture on a scale of 1 to 5, with 5 being the best. And the second question I would appreciate if you can answer is, rate your organization's data governance initiatives on a scale of 1 to 5, with 5 being the best. So if you could please respond in the comments section below the video, I would certainly appreciate it. Well, I'd like to thank our guest speaker, Dr. John Lee, for his time and insights. John, do you have any closing remarks that you'd like to make, about this, what appears to be a very exciting topic around data governance?
Well, I don't know how exciting it is, Greg, but it's certainly necessary.
Yeah.
I would just implore as many, particularly the clinical and operational folks, to be more patient and ask about data governance, and ask how they can work with the business intelligence teams to create nuggets of data that are meaningful, accessible, retrievable, reusable, and think about that the refinement process of the crude oil to gasoline, so that no matter where the crude oil comes from, no matter what the raw data shows, out comes a product that actually is meaningful, that you can use and repurpose without necessarily knowing what the refinement process actually is. And I think this is going to be of critical importance for any healthcare leader as we move forward, because there's a lot of work to be done here.
Awesome. I'd also like to thank our sponsors today, Storage Systems and Simplify Medical. Lars and Keith, do you have any final thoughts before we close?
Yeah, all I'd say is, Storage Systems Unlimited, we've been around for a long time, over 3 decades, and really, like to get in early in a project with architects, contractors, equipment planners, and really leverage, all the data and insight that we've learned working in healthcare facilities for over 30 years to optimize the efficiencies of the room, of the nurses, of the doctors. So I see how we relate to this subject and appreciate a great presentation by John.
Yeah, I really appreciate John taking the time, sharing his insights. I learned a lot about the complexity, sort of the leadership challenges that it takes to be effective at pursuing data governance, but also feel like, some of the spirit of Beyond the Blueprint, where you talk about design, when you have projects, maybe the opportunity to grab those quick wins, like John talked about, whether it's the ED or the new facility that's opening. Maybe that's the opportunity to bring in this thinking that once you've done it a few times, I can clearly see how that could benefit the organization. So really would love to have John maybe come back in the future and learn more about the topic.
Awesome. Thank you for having me.
Thank you again. We look forward to continuing the conversation with our next scheduled episode of Beyond the Blueprint. Until next time, thank you.